evening. We are HYPERmelt, a simple, sensitive platform for early cancer detection. Meet Jody, a healthy mother of 6 who leads a fit lifestyle. She's up to date on all her testing. She gets her mammogram, her pap smear, even her colonoscopy. But at age 53, she started feeling some abdominal pain and went to see her doctor. Jody was diagnosed with stage 3C high-grade serous ovarian cancer. Suddenly, Jody's life was flipped upside down as she faced months of chemotherapy and a poor prognosis. You can read more about Jody's story and dozens of others on the Ovarian Cancer Survivor Network, because this happens to thousands of women every year, largely because the CDC reports no simple and reliable way to screen for ovarian cancer in women who do not have signs or symptoms. So most women are diagnosed at stage 3, where the 5-year survival rate is dramatically lower than if the cancer had been caught in stages 1 or 2. At HYPERmelt, our mission is to catch this cancer early, to empower patients with the early knowledge they need, to give them increased treatment options. This will lead to cost savings, reduced hospital stays, and ultimately lives saved. To do this, we use a molecular analytics technique to identify early indicators of cancer development. Before a tumor is formed, healthy cells experience a loss of regulation, leading to an increase in variability of DNA profiles among cells, until eventually a founder tumor cell is formed. One type of change that occurs in this early developmental stage is DNA methylation, which increases in variability even before mutations. Our technology is designed to detect this increase in methylation variability to identify cancer formation as soon as possible and provide patients with the knowledge they need to get treatment early and respond more effectively. To do this, we need a technology that can detect rare events and quantify variability. There are 2 main ways people detect methylation currently. PCR is an extremely sensitive technique but provides limited information about a sample. Sequencing can detect all number of DNA modifications but is limited in sensitivity. HYPERmelt is an ultra-sensitive technique that can quantify heterogeneity of numerous genes simultaneously. HYPERmelt uses a microfluidic device to digitize tumor DNA collected from non-invasive samples into thousands of microchambers. The device is then placed on a platform to perform high-throughput analysis, combining PCR with a novel technique called MELT, enabling a quantitative output of molecular variability within a sample. Our technique is non-invasive, low cost for routine screening, extremely sensitive, and high throughput, faster and simpler than sequencing. To date, we've completed proof of concept prototype and early testing. The prototype contains a cartridge to load the samples and an analysis platform to quantify methylation variability. We've tested a small cohort of DNA from pap specimens from healthy and ovarian cancer patients. Even with a small gene panel, HYPERmelt can clearly detect differences in DNA from ovarian cancer and healthy patients, identifying 75% of cancer samples with 0 false positives. In the U.S., about 22,000 cases of ovarian cancer are diagnosed every year and 14,000 deaths. By targeting U.S. women ages 45 to 85 with insurance, we can detect about 85% of ovarian cancer cases. The market now is estimated at $2.2 billion and is expected to grow. But in addition, the platform is easily extendable into other markets such as endometrial cancer or bacterial infections leading to sepsis. Here is our team. I'm the founder and CEO. Yang is our assay specialist, and Sean is our software engineer. We have 2 principal advisors currently with expertise in engineering and cancer epidemiology. To date, we've completed engineering the platform and have started identifying our key biomarkers. Moving forward, our next steps are to validate the biomarkers by analyzing more patients and scaling and developing device and instrument manufacturing so that we can meet our next major milestone, FDA pre-submission meeting. Then we can move on to clinical trials to gain FDA approval and hopefully start generating revenue by 2023. Our critical needs for funding now are mostly to ramp up sample testing. We will need hundreds of cartridges to test samples, and we will need to acquire early-stage phases 1 and 2 samples to validate the technique for screening. We also plan to start engaging early with experts in manufacturing according to FDA guidelines, legal consulting for IP and incorporation, and regulatory consulting moving forward. Thank you very much for listening. We are HYPERmelt. We want to help people fight cancer early.